In 24 hours, the number of novel coronavirus cases in New York State doubled from 11 to 22. In New York City, a total of 3. In 2 of those cases, officials believe the patients were infected through community spread. They have no links to the 5 most affected countries.
Both are critically ill at this moment. Both did have substantial pre-existing conditions.
Meanwhile, there are now 18 confirmed cases in Westchester County, where there's a cluster tied to a 50-year-old lawyer who lives in New Rochelle and works in Manhattan. It's also a suspected case of community spread.
We have as many as 1,000 people that could have been impacted by the original individual.
Many attended events at Young Israel Synagogue on the weekend of February 22nd. Long Island has also reported their first case, a 42-year-old Nassau County man being treated in Mineola.
The goal now is to avoid community spread.
We're coordinated, we're on top of it, we're diligent.
And now New York City officials say they're monitoring an entire classroom from James Madison High School that recently traveled to Italy's most affected area. A teacher, 44 students, and 6 staff members. The teacher, who has symptoms, tested negative, but school officials are keeping a watchful eye. In New Jersey, 2 presumptive cases of coronavirus have been reported, which means the patients have tested positive for the virus in local testing, but still have to be confirmed by the CDC. One of them is a 32-year-old healthcare worker who works in Manhattan but lives in Fort Lee. He's currently hospitalized at Hackensack Medical Center.
We are working with our partners in New York closely to carefully trace all points of contact for this individual.